It's important to understand the skeletal structures of the legs to accurately draw the figure. The legs are just as expressive as the arms and any other part of the figure, and they're comprised mainly of these major bones that you see here. With the upper leg, the femur is the primary bone, and you can see it connects to the pelvis, and it comes in. It's always important to remember at a slight angle, like you can see in this illustration here. So keep in mind that even when the figure is standing still, that upper leg bone actually casts down at an angle. So the femur attaches to the pelvis through something called the greater trochanter. And why that's important to know is, as you're looking for the skeletal landmarks of the figure, always remember that it's an important part that's buried under a lot of cartilage and muscle, but it's down from the crest of the hip bone quite a bit. And you can see it here when you look for it in the figure. There's generally a shadow on the side of the hips below the arc of the hip bone. And where that shadow is generally about where under the musculature that part of the hip bone is. And you can find this on your own body, actually, if you put your thumb on the crest of your hip bone and then extend your index finger towards the center of your leg, you will generally be able to kind of feel the edge of the great trochanter, which is at the top of the femur. And again, important to remember, it is actually attaches pretty far out to the hips. So that's what causes that natural sort of angle as the figure stands at a normal stance. It's also important to remember that the hip bones are the animating part really of the legs. And if the legs tilt one way, if the pelvis tilts one way, the legs will follow along. In the patella, or the kneecap, is always an important skeletal structure, and one which is relatively easy to find. You can see in this illustration here that it's generally covers the gap in between the upper femur and the lower leg bones. It's easy to find, but there's a lot of tissue and mass and musculature around it, so it takes a little bit of interpretation. So in this illustration here, you can see underneath or on top of the patella, the kneecap, you can see that tendon, which is really strong, stretches over it and connects with the upper part of the bones of the lower leg. So as you're looking at the figure, keep in mind that what you're seeing is a couple things. There's sort of a bulge at the top, which is the patella and the kneecap. And then there's another bulge at the bottom, which is kind of the front part of the lower leg bone actually coming forward. And the areas above it are relaxed sort of tissue and musculature. So there's sort of some bagging that happens over there. In this painting here, you can see beautifully rendered examples of that part of the leg. And you can see here the beautifully rendered kneecap. There's that shiny part here is the tendon attaching to that forward part of the lower leg bone. So you're seeing something like you see in that illustration on the left happening here. In the lower leg bones, similar to the lower arm bones, they're comprised of two different bones, actually, the tibia and the fibula. And it's the tibia and the fibula really make themselves most known apart from at the very top under the knee, but also in the ankles. So for example, on the right here, the image, you can see very clearly that on his outside leg, what you're seeing is the bottom edge of the fibula, which stretches up and then sort of disappears under the skin. And then on this side, what you're seeing is the tibia, And then you can see the rest of it along the ankle here, which is why whenever you hit your ankle, it gets a really sharp pain because that bone is right under the surface there. So keep that in mind and look for it as you're drawing from the figure with the lower leg bones, that you will see evidence of it at the just under the kneecap, you'll see, and then particularly around the ankles. Remember that those ankle bones on either side are actually they're actually the lowest part of the leg bone. They're not part of the foot actually. And with the foot can be thought of, definitely it helps to think of the foot being housed essentially in by those two lower leg bones. So when you draw it, sometimes a light line visualizing it, how it sort of fits in, the top of the foot fits in almost like a socket and is sort of housed. Even though you don't not necessarily visually see it, it helps to help you visualize it yourself, like in this photo here, that on either side of those ankle bones there that house the foot.